statements are a part of the record and the members have had an opportunity to review them. I think in the interest of time, why don't we begin to proceed? I'll recognize each of you for 5 minutes and we'll give you a little bit of guidance in terms of the timing, and then we'll open it up for questions from our members. So again, thank you for your patience. We really, really appreciate it. Dr. Benyamin, you're recognized for 5 minutes.
Chairman Roscom, Ranking Member Levin, and distinguished members of the committee. Thank you for the opportunity to provide my views on behalf of American Society of Interventional Pain Physicians, known as ASIPP. I'm Dr. Ramsin Benyamin, and I'm the Medical Director of Millennium Pain Center in Illinois. I've been practicing interventional pain management for over 20 years. My academic appointments are with the University of Illinois, Illinois Wesleyan University, and A.T. Still University of Missouri. I serve on the editorial board of several pain management peer-reviewed journals and have over 150 publications, the most recent of which is our Society's 2017 Guidelines for Responsible, Safe, and Effective Prescription of Opioids. In the past, I've served as the president of ASIPP, and I'm currently on the board of directors. I'm also the president of Illinois Society of Interventional Pain Physicians. ASIPP is a non-for-profit professional organization founded in 1998, now comprising of over 4,500 members who are dedicated to ensuring safe and appropriate access to pain management services using interventional techniques in addition to medical management. As an organization, ASIPP has always been cognizant of prescription opioid dangers and began issuing warnings and offering preventive measures in early 2000 with its proposal of a national program known as NASPR, which eventually was signed into law as a state-run prescription drug monitoring program in 2005. Despite challenges in implementation of the national program, all 50 states now have prescription drug monitoring programs. Many of the common painful ailments like spine degeneration, disc herniations, spinal stenosis, headache, pathologic fractures, and post-surgical chronic pain, if not managed timely by interventional pain techniques, will result in more invasive and costly procedures, raising the risk of dependency on more or higher doses of opioids. Currently, 1 in every 3 Medicare Part D recipient is on prescription opioids. Based on current data, despite reduction in opioid prescriptions since 2010, the majority of overdose deaths are mainly due to synthetic fentanyl and heroin abuse. Mr. Chairman, the pill-to-heroin shift has occurred, and that also involves lacing of marijuana with heroin or fentanyl. That's killing many of my fellow citizens in Illinois. As a result of this disturbing trend, on behalf of ASIPP, I'm suggesting legislative reforms to curb opioid abuse and reduce opioid deaths, while maintaining appropriate access and promoting non-opioid modalities like interventional techniques. Unfortunately, reductions and cuts continue to limit access to physical therapy, interventional techniques, and even non-opioid medical therapies, while the opioid death rate continues to escalate. Our proposal includes a 3-tier approach. Tier 1, an aggressive public education campaign focused on the dangers of illicit drugs, specifically heroin and fentanyl. A public education campaign relating to the adverse consequences of prescription opioid abuse, particularly in combination with benzodiazepines. Mandatory 4 hours of continuing education for all prescribers of any amount of opioids or benzodiazepines. Tier 2, improved access to non-opioid techniques, including physical therapy and interventional techniques, by lowering or eliminating co-payments, expanded low-threshold access to buprenorphine for opioid use disorder treatment, enhanced prescription drug monitoring program, including a national program like NASPR, with states having mandated capability to interact with the rest of the states, or at least the neighboring states. Mandated review of prescription drug monitoring data by all prescribers prior to prescribing a controlled substance. Tier 3, buprenorphine must be available for chronic pain management with rescheduling it to a Schedule II. And remove methadone from formulary. This medication, despite being only 1% of total prescription opioids, it results in more than 3,000 deaths every year. Thank you again for allowing our organization the opportunity to testify. I'll be glad to answer any questions.
Thank you. Mr. Kletter.